Hello and thank you for joining in on today's training. Heart & Solutions is a proud provider of CE-eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below to find and take your quiz.
My name is Dr. Colleen Grote. I am the Vice President here at Heart & Solutions, and welcome to another episode of You Need a Training. In today's episode, we're going to be focusing on trauma-informed communication. Thank you all so much for being here today. Today's training aims to equip professionals with yoga therapy principles to improve both verbal and nonverbal communication in trauma-informed care. Participants will explore how yoga therapy can be utilized to establish a deeper connection with patients, facilitating a healing environment conducive to recovery and well-being. And I am thrilled today to be able to present our guest trainer today, Eva ZobianWolf. Eva's done some podcast episodes with our other podcast arm of Heart & Solutions called You Need a Counselor. So if you haven't checked those out, please be sure to do that as well. But Eva is a mind-body specialist, a nurse, and an adaptive yoga therapist who owns Eva Z Wellness. Eva is the founder and CEO of Eva Z Wellness, which is a mind-body and is a mind-body specialist, a nurse, an adaptive yoga therapist. Eva focuses on chronic illness, chronic pain, and mobility challenges while helping chronically exhausted nurses reclaim their vitality. Through personalized mindfulness plans and transformative sessions, she reduces stress, increases energy levels, improves sleep, and empowers individuals to take charge of their overall well-being. Eva's diverse range of modalities includes adaptive yoga therapy, Reiki, and other mindfulness-based practices. She has over 2 decades of medical experience and brings extensive knowledge and expertise to her clients. Eva's dedication extends beyond her practice as she volunteers with adaptive cycling organizations and collaborates with addiction recovery organizations. In her free time, Eva enjoys outdoor adventures with her husband and English bulldog, exploring state and national parks. So I am so excited, Eva. All of those things, as I read through your bio every time, I'm like, yes, please, yes, please. So thank you so much for being here. I know that you will walk us through so many things today, including just defining what trauma-informed care practice is and looks like, and understanding how yoga therapy can play a role in that, and how to apply those principles of yoga therapy to our space with clients and creating those co-creative spaces, and allowing them to develop those personalized strategies and how to integrate yoga into practice and supporting clients' trauma recovery. So Eva, thank you so much for joining us this morning. We cannot wait to learn more.
Oh, well, thank you so very much. And I really I appreciate being invited to be here, Colleen. The collaboration that I have with You Need a Counselor has just been fantastic. And this is a topic that is near and dear to my heart because I have been in the medical field for over 20 years, worked in the ICU as a nurse, as a charge nurse, and experienced what exhaustion, burnout, and also how does that affect our interactions with other people? How does it affect our interactions with our coworkers, with our patients, with our families? And so trauma-informed communication is about creating these spaces where it's a co-creative conversation. It's a co-creative interaction, but even more so, it's about creating this sacred space that allows for that enhanced collaboration between everybody that's in that space, where everybody feels seen and heard in their most brave way. And yoga therapy has been just absolutely instrumental in my journey in terms of being able to heal and recover. But it's also opened my eyes because I did have so much medical training and worked in so many different areas in terms of different spaces of the medical field, working in the lab, working in phlebotomy, working in different areas of the hospital, and then working in the ICU and interacting with so many different people. This connection that we have is incredibly important. And the communication a lot of times can be our downfall. And so let's talk about how we can use yoga therapy principles and integrate that so that we are improving our communication and ultimately creating that relationship with the person that we're speaking with, whether that's a patient, whether that's a friend, whether it's a colleague. And to do that, we're going to focus today on equipping providers with different yoga therapy principles that can be effective for trauma-informed communication. You went over this a little bit. We're really going to focus in on what are the verbal and nonverbal communication that allows for those environments that create empathetic, collaborative spaces, and how do we use different yoga therapy principles to enhance our understanding of what a patient needs and to support their healing process. One of the big aspects of trauma-informed care is fostering trust and creating a space that allows for resilience. A lot of patients feel that their concerns are not being addressed because providers, and this is not specific to any one branch of healthcare, but a lot of times they're feeling that they're through a checklist rather than having patient-centered interaction. And one thing that's really, one study that was done shows that if patients had their concerns addressed and it was in a patient-centered interaction, the patients actually overestimated the amount of time that they spent with their provider. And so when we have these patient-centered interactions, when it's a very co-creative space, it allows for more trust. It allows for more interaction, allows for that deeper connection. So again, our objectives today, defining what's trauma-informed care and why is this relevant? Understanding how yoga therapy can be involved, and then applying those principles to both verbal and nonverbal communication. And then what are the different strategies that you can use to create that client interaction that allows for, by using trauma-informed communication. So first, let's talk about trauma-informed communication and how does this enhance trust and safety? How do we recognize that we say trauma-informed, but one thing to remember is we're not just talking about folks that have high ACE scores. And the thing is that how many people have at least one ACE score? And that's still going to affect them. But also, these adverse events don't necessarily just happen in children. There's also different events throughout our lives that create that residual effect of trauma in the body. And this is where yoga therapy principles can be really integral in assisting us to be able to understand that everybody that walks through the door, every space that we walk into where we're interacting with a person, that person may have been through some type of traumatic event, maybe experiencing some type of traumatic event, and or having the residual of that colors and affects the perception of the way that they're going to view our interaction, meaning that how somebody's nervous system, the state of somebody's nervous system, is going to affect how they're perceiving the interaction. And so when we use trauma-informed communication, what we're focusing on is facilitating that healing process by recognizing and avoiding triggers. And this is where that verbal and nonverbal communication really comes into effect. One of the things we want to do is provide that supportive and empathetic environment that fosters that empathy, that creates that collaboration. And we can't always create a safe space, but we can create a supportive space. And that's the space that allows for someone to begin that journey of moving through and navigating their healing process, however long that may take. So yoga therapy and trauma-informed care supports this by balancing the nervous system. Yoga therapy focus is specifically on where is this person in this moment, meaning that what's the state of their nervous system and how do we assist in developing that awareness for ourselves and also for our client. When we are interacting with someone, being able to provide resources that allow for self-regulation, the way that it is communicated to somebody is going to affect the acceptiveness of that. Meaning that if I'm focusing in on what's wrong with the person, then immediately their defenses shut down. Their body language closes off. How do we foster this emotional regulation, this nervous system regulation, by allowing and promoting different techniques, things like mindfulness, breath work. This helps people to get more grounded in themselves in those interactions, and it creates that space of safety. So what we can do is we can create this presence that feels non-judgmental and calming, and that's essential for trauma-informed care. So I don't know if this is aligning with you. I would love if somebody would drop a comment in the chat, or if you've had an interaction where, and I say this because, again, coming back to the type of interactions that I was having prior to my development of my yoga therapy practice and my training, I recognized that there was a lot of times where I started a conversation and I immediately put somebody on edge. And this is me in a compassionate space saying these things and not recognizing that the way that I worded the question immediately shut down the person. And so in this, it's important to recognize that how we interact with others, how we set the stage, is really how we create that relationship of trust. So with that, let's talk about those principles of yoga therapy. So the core principles of yoga for trauma care is rooted in mindfulness, body awareness, and grounding techniques. Paying attention to that mind-body connection. In yoga therapy, we have something called the kosha model, and that is a principle of understanding the different layers, the different sheaths that our consciousness goes through as we move through an understanding of and a connection of our own awareness. And we always start with the body, because it's very difficult to bring concepts of meditation and mindfulness when someone is unable, when they're disembodied and they're unable to feel physical sensations within their body. So by starting in that initial state of how do I recognize in my body something as simple as, am I breathing? Am I holding my breath? Am I tightening my body? Am I hungry? Am I thirsty? Do I need to step outside? Do I need to eat something? All of these things are ways for us to connect with someone. And then by using these principles, these are moment wins. By simply asking someone if they can bring one hand to their heart and one hand to their belly, and then just breathe in and have a long breath out. Our parasympathetic nervous system is activated by our exhales. They're directly tied. And by extending the exhale, we immediately have that sensation of cooling and calming in the nervous system. And that can be something that, when we're not aware, creates an immediate connection. And the benefits for this are simply calming the nervous system. We have so many ways in today's society in which our sympathetic nervous system is activated. What we don't have are enough instances where we are cooling our nervous system. And when we bring these very simple techniques into an interaction, we're able to start to create that sense of trust. We're able to create that sense of, this is a safe space. This is a space where you are supported. This is a space where you are seen. And all of this allows for the more deeper conversations. It establishes that security and that compassionate, therapeutic relationship. And that is integral in order to being able to do the deeper work. If we can't establish safety and compassion immediately or in the initial stages of a relationship, it sets the tone for the remainder of the relationship. And there's many opportunities that get missed when this relationship isn't happened. I'd like to share an example of an interaction that I had last week. I went into primary care office, and as a nurse, I held certain procedures sacred. One was asking someone if they felt safe, if they felt, if they were experiencing abuse, and also, did they fear for themselves, or were they in a situation where they could potentially harm themselves or someone else? And I'm working on this. When I go into a doctor's office and they ask me those questions, if someone doesn't look me in the eye and ask these questions, to me, that feels like that person failed in that moment of connection. This person didn't even ask the questions. She didn't look up from her computer. She just said, any domestic violence going on? And then I just kind of looked at her and turned my head and I went, no. And she carried on. And I said, okay, time out. I have a question. How would you know? And we had a conversation about it, and I said, look, you can do whatever you want for the remainder of your career. You can take this if you like or ignore it. However, that moment when you look someone in the eye and you ask that question and they know that you're listening, that might be the one moment that they lower the mask and you see the real person. You see the real pain. And all of this, all of these techniques and all of these principles that we're using is ultimately to be able to have that connection to where a person feels safe to remove shields, to remove the armor, to drop the guard enough to be their authentic self, to say, this is where I am, this is what I'm experiencing. And so in these sessions, in these interactions, when we are connecting with a person and creating this sacred space, this allows for the work, the deeper work that we're trying to do with someone to be initiated. And that's why we're all here, right? This is why we went into the fields that we're in, is to be able to work with people and to provide the tools and resources for them to be able to navigate their journey, to be able to introduce healing processes into their life. And that's important to you. Please just drop an emoji into the chat for a moment, and let's just recognize how absolutely amazing everybody that is attending this, how amazing you are for the incredibly compassionate heart that you have. Thank you. Yes. And thank you for being here. Thank you for the work that you do. And this is one of the challenges that all providers have in terms of, and this is why it's important for providers to do their own self-care, is so that we remember that these connections, these moments are important. This is how we get meaningful change to occur for our clients and for our patients. So thank you for that. All right, so techniques for enhancing verbal communication. A lot of you are already very well informed on mindful speaking, being intentional, choosing words that convey empathy and safety. This is an incredibly powerful communication technique that allows for us to create that connection. When we choose words that convey empathy and convey safety, we are setting the stage for that communication to happen. And through that, active listening is how our patients can feel heard and validated. And this is the key to trauma-informed care. When we are listening, and a lot of times people think that listening is a passive process where you're just sitting there and you're listening, but active listening is, how do I pay attention to not just the words that somebody is saying, but the type of words that somebody is saying? Because this is where they're going to give that information. This is where they're going to provide those keys to, do I feel safe? Do I trust myself? Do I love myself? Do I feel compassion for myself? The way that that a patient makes eye contact with us when they're talking speaks to their confidence level. And here, this is the principles of yoga therapy applied in active listening are going to be paying attention to the body posture. And here we would look at some of the different chakras. So the throat chakra, are they speaking slow? Are they speaking fast? Are they speaking very quietly? Are they speaking at a normal voice? Are they speaking very loud? Do they overtalk when I start to speak? Do they say a lot of words? And the longer that I sit in silence, do they feel the need to fill the space? So the throat chakra, that area is going to give us a lot of insight into how somebody is feeling. The heart chakra, how somebody stands, if they're very closed off, or if they feel more open and compassionate. But also, what are the words that they're using about themselves? Are they using a lot of words where they are speaking negatively? And that's going to give us information about their inner world, their self-talk. Are they immediately putting negators into the language? This is something that I need to work on, but this is something I want to do, but. And immediately that gives us an indication of how are they reframing things. This gives us an indication on their self-talk. And that's again, a really important area for us to pay attention. And then invitational language, this is something that is incredibly important in terms of setting the stage. Invitational language is, they're phrases such as, if it feels comfortable for you, how would that feel? I invite you to. When someone walks into a room and says, tell me how you're feeling, that may create a wall. But instead, does it feel comfortable for you to, do you feel comfortable speaking about this? In yoga therapy, we use this a lot in terms of asking for consent on a lot of different things, reminding people that they have their own internal landscape and to listen to themselves before listening to us. And I will tell you that one of the in the last few years that I have noticed that the most triggering statement that I can say to a client is, you are the king or queen of your own body. Because that has not been their experience, and they immediately say, that's not what people tell me. That's not how it is in the real world. So instead, how do we create these environments that remind people that their experiences are valid? What they're experiencing is their experience. In the medical community, this happens with language like non-compliant patient, drug seeker. Instead of asking about what the obstacle is, we're immediately putting labels onto clients. So and when I say invitational language, this is not just something that we talk about with the person, but it's also how are we representing them within ourselves. So invitational language is a huge driver in being able to create that space that says, you are welcome here. I see you. I can't understand what that experience feels like because I'm not in your body. So tell me what that experience is. And in that, and again, coming back to the nonverbal communication, that when we ask a question, paying attention to what's the response. Invitational language is a way for us to develop that relationship of safety and trust by asking, that seemed like that created some type of response in your body. Would you feel comfortable talking about that for a moment? And as a yoga therapist, my role is, okay, that I saw that there was some type of reaction there. Where did you feel it in the body? Okay, here's the techniques that we can use for that. Let's do some breathing. Let's do some movement. We can incorporate journaling. As therapists and counselors, as mental health providers, these are those opportunities to start to unpack. Okay, this is where we saw it. Where did you feel it in your body? Now, where do we go from here? And then this is where your expertise and your knowledge really starts to be applied because you're seeing it happening in action and you're recognizing it. And your client, that's that moment of deep connection. When we feel seen, when we feel heard, when somebody recognizes the impact that memories, trauma, whatever the obstacle is, by acknowledging it, we've brought it to light. And so this becomes incredibly important. And I wanted to share this with you. This is a loving kindness meditation. It's also known as a meta meditation. There's a QR code here for you to, this is simply just a link to a recorded loving kindness meditation on my YouTube channel. This is a way to be able to foster empathy and compassion. Yoga therapy incorporates lots of practices like a loving kindness meditation, because it helps you to develop this empathy for yourself. It brings about, and the process of loving kindness meditation is, may you be happy, may you be healthy, may you be peaceful, may you be safe. And there's many variations of these words, but you're using these words towards yourself, thinking of somebody that you love, thinking of a teacher or a mentor, and also thinking of somebody that you have a difficult relationship with, and then thinking of the whole, like all beings. Because we go through that spectrum of, I have many people in my life, whether they are positive or negative relationships. These relationships were connected to all of these people in some form or fashion. And by developing this compassion for someone else, for ourselves, it's a way of creating that deeper connection, and it fosters, again, coming back to the heart chakra, this is a way of bringing that expansion of gratitude, compassion, kindness, and that understanding that allows for those meaningful and respectful exchanges where I'm able to put myself in the place of another to understand where they are. And so by developing these patience and developing these listening skills, with meditation, focused breathing, yoga therapy is a way for us to cultivate that patience so that we can sit and listen and not have that immediate reaction. Fair warning, it was very challenging for me to listen to that meditation the first few times that I listened to it. It did bring about a lot for me. And so just remember that everybody has we all have different nervous systems. We all are in different spaces. And so if listening to that meditation elicits some type of emotional response for you, I invite you to navigate that in a way that feels comfortable for you, whether that is journaling, movement, stepping outside, finding some type of practice that assists you in recognizing, seeing those feelings, and then moving through them in a way that feels comfortable for you. And that may also be putting that in your back pocket for a little while and coming back to it when you're in a different state. So with that, let's talk about these mindful speaking techniques. So again, nonverbal cues, things like the posture and eye contact can convey empathy and foster trust. Mindful presence is a way for us to be there with patients. And that can be really grounding for people that are navigating higher versions of trauma recovery. Developing self-awareness and reflection is a process that comes from yogic practices, it's our ability to be able to be aware of personal space and tone and gestures that helps a person to feel respected and safe. And this can enhance emotional regulation by calming the nervous system. When a person feels safe, they are much more likely to be more open and honest. And so setting the stage for that by creating a space that, and these can be things in yoga therapy, we do this by creating the space of you are seen, you are heard, but also it's the physical environment of space as well, too. How we sit, letting someone know that if it feels comfortable for them to close their eyes, or they can create a soft gaze, or they can find a focus point. But also, my physical presence is I'm putting myself between the door and the space, but letting them know that if they need to step out for a moment, they are free to do that. That if they decide that they want to opt out of a particular practice that we're doing, they can always say, they can always choose not to do it. They can choose a different version of it, giving lots and lots of variations and offering the option for them to choose the one that feels most comfortable for them in that moment. So how do they develop that self-awareness? Again, these practices of grounding, something as simple as bringing one hand to the heart and one hand to the belly, placing their feet onto the ground, and then just going through breathing in, breathing out. And then what did they notice as they were doing those practices? What did they feel? Did they feel the breath moving through their body? And then bringing them to, okay, well, let's focus in on longer exhales. And by doing that, we're creating that awareness and also giving them a tool that shows them that they can down-regulate their nervous system by creating that breath. And again, in all of this, we're using a tone that says, this is your decision as to how do you do this. We're using gestures that say, this is your space. This is your experience. And we do this through the way that we use our body language. We do this through having eye contact, focusing in on the person, and making sure that our own presence is downregulated. Everybody here, I'm positive, knows about mirror neurons, and that if somebody is having some type of physiological response, our nervous system will in turn start to get amped up. And by having our own mindful presence, it means that we're going to be able to use our own techniques to down-regulate our nervous system so that we are staying present, we are staying grounded, and we are providing that space that allows for their mirror neurons to down-regulate. So having our own self-care practices is incredibly important to be able to create that space of mindfulness so that not only are we there, but we're also leading them into a calmer, more relaxed state. And in that, we create, because the goal here is create a co-creative space, create that safe space for the client to be able to express themselves in the way that they feel they need to in this moment. So then how do we integrate yoga therapy into patient care? It's important to have an action plan that is centered on the client, right? But also having these plans for ourselves. So we're creating personalized strategies for ourselves, for our daily practice, and then bringing that same effort to our client, where we're integrating these practices in how we interact with our clients and doing this on a daily basis. So discussing how this could be a challenge is where I would like to move this to. So how do we bring this into our practice? And in the mental health arena, you guys are so much better at this than the medical community is. All through well, the last few years, I've been doing a lot of, asking medical providers in different roles, what do you know about the nervous system in terms of emotional downregulation and practices in order to be able to facilitate that with your patients? And everybody, for the most part, said, what? It was only people that were interacting either in the mental health world as medical providers or strictly mental health providers that said, oh yeah, I know about that. Now, the question is, and you guys know, every time that we practice something and we know something, it can go on autopilot and we may deviate away from it, which is why it is important for us to have these continuing education resources. So it's important for us to have these interactions because we ourselves are human beings and our own nervous systems are going to come into play that are going to shift us into our own sympathetic nervous system activation that's going to lead us away from the more down-regulating practices. And we may find ourselves doing more of the check the box work rather than person-centric care. So I'd like to open up the floor to what are the different challenges and solutions in terms of what are some potential obstacles in utilizing this in real world settings. And feel free to either unmute yourself or drop a comment into the chat. So I would love to hear. Actually, let me rephrase that and use invitational language. If it feels comfortable to you, would you be willing to share an example of how this is a struggle for you, or what do you see as an obstacle for putting this into practice? And I'm sure that time is going to be one of the biggest factors that people come up with, right? Time is always an issue because the more that we are with people, how do we create the time for this? Because there's so many things that we need to do in a patient care situation. So how do we incorporate this into our practice in the most beneficial way and still get all of the other things that we need to do? And by one of my strategies for this is by practicing this in every interaction. So it's not just when we are working with a client, but it is also these interactions are happening when we're with our coworkers and when we are interacting with friends and family. Also, and thank you for this question or for this statement, one of the obstacle is by not having a lot of room in the space where we are. And here's one of the things that, and this is a great question, because how do you how do you create space in a small space? If I'm reading this right. And so by being remote, how do we pay close attention? And actually, you're going to be even better at this because you are working remote. Because people are generally going to be from at home, or they're going to be in a space where they are separate from others, hopefully. But you're also going to be interacting with them. They're going to be on camera And it's paying attention to how they're making eye contact, how they're looking at the screen, their voice, their demeanor, and one of my favorite things when somebody says, I can't possibly do yoga because I'm not flexible, is I say, are you breathing? Because if you're breathing, everybody can do yoga. And so in this, how do we bring them to their body? And this can be, again, it's very simple. These techniques are things that anybody can do in any situation, bringing one hand to the heart and one hand to the belly, and then coming to breath. So the movement doesn't have to be big and expansive. It can be simply bringing them into their body and holding that that connection. So bringing that disembodiment to light by bringing them into feeling those sensations. And they can do that whether they're sitting, standing, or lying down. Another comment, working with children and adolescents, and sometimes it's hard to get them to engage and focus when doing mindfulness practices. This is where we do more adaptive type things, where we're going to make the mindfulness practice more fun. So one of the things that we can do is to incorporate things like chanting. And that when I say chanting, we can do things like by using different mantras, like Sata Na Ma is one of my favorite things to do because it can be playful, but it can also be made with any sound. We can also incorporate this into one of my favorite things is a bubble meditation, where we imagine that there's a bubble inside of our hand and we breathe in and the bubble expands, and as we breathe out, the bubble shrinks. Now we can do this with an actual physical ball, where we're holding onto the ball and we're squeezing it as we exhale, and as we inhale, we're letting it open back up. And doing this with expandable toys is a fun way to do this. We can do this by it's a raisin meditation, mindful eating, where you take a raisin and you're holding on to the raisin and you're seeing it, and then you're bringing it into your mouth and you're paying attention to it. So here you can play and explore and have lots of different ways to be able to incorporate this. And yeah, so it was another question. Are there logistics that need to be considered for those that are not certified in any type of yoga training? Depending on the resources that you're using, and that's a good question too. Like, how does this, when does it come to documentation or billing? So there's also a way for you guys to collaborate with yoga therapists as well too. And that's going to lead to the next slide here in a moment. So I'm going to sort of answer this question and then not answer this question. But there's one more thing that I wanted to address in this. Is there certain language that we should use or avoid to ensure that we describe what we are doing accurately without misrepresenting ourselves? A lot of these tools are things that you guys are already using. You are already using a lot of mindfulness and breath exercises, and incorporating these in a way that feels comfortable for you. Using these as in the arena that you are in. So this is a mindfulness exercise. We're going to use breath work. So rather than incorporating the yoga therapy dialogue, instead, how do you represent it in a way that is authentic to the training that you have? And I say this because I'm having to do the opposite, where I'm a nurse and a yoga therapist, but I am not a mental health provider. And so I have to be very cautious about, okay, where do you feel this in your body? And the only way, if feelings and things come up, I need to be mindful that I'm not stepping into the role of mental health therapist, and instead bringing it back to the body and giving them tools and techniques that they can use where they're doing the work and I'm not stepping into that role, that I'm staying within my scope of practice. And those are all really good questions. So thank you for that. So how we implement this into your practice. Okay, resources for further learning. There are lots of different workshops, continuing education, and yoga therapy. C-IAYT is a great resource. You guys have another great resource as well, too, in that, and I will be sharing my information as well, too. Professional resources on trauma-informed care. There are so many different places that are advocating for trauma-informed care, and it's important for how we move forward that we're utilizing this more, because again, we're empowering clients to take ownership and self-agency over their own experience. And really, ultimately, trauma-informed care is simply that. How do we recognize that a person's experience exists, and how do we give them that, we remind them that they have those tools, they have those resources, and it's the utilization of those resources in a way that makes sense for them that helps them on their journey. So these were all great questions, and I love that you guys had these questions. So we are reaching the end of our time. I would invite you to join me on social media or connect with me on my website. And I would love to continue this conversation. And definitely, I invite you to connect with me, to ask more of these questions. I am always open and willing to have these conversations, to connect and support in a way that is meaningful for you, to be able to show up for your clients in a way that fosters this resilience, that fosters empathy, that fosters healing. Because what a fantastic world we would be in if everybody was creating these spaces, regardless of how they connect with people.
Absolutely, Eva. I mean, such wonderful information. As we were nearing the end of time, I was like, no, I don't want this to be over. We could keep talking for so long. And I think for me, I think we hear, things like, yoga and, trauma-informed yoga. And for those of us that maybe aren't as familiar with it, or definitely, aren't certified to instruct things like that, I think there's a tendency to kind of shy away and go, oh, that's not for me. And being able to really think bigger picture and how to incorporate those practices in a way that does align with the skill sets that, all of the providers attending this training and those to come have, and bringing that in, I think is just such a nice kind of refreshing framework for that of, oh yeah, that part is me and I can do that. And so I really, really appreciate your knowledge base there. Thank you all again so much for joining today. Thank you, Eva, for this information. And don't forget, you need a training.
Thank you for joining in on today's training. We look forward to having you join us again. Heart & Solutions is proud to provide CE-eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below.